Hair thinning and hair fall, loss of hair from the scalp, is a fearful condition for each one of us. We keep facing these problems because of the seasonal changes, because many of us have nutritional deficiencies, we go out in the sun, environmental conditions, sometimes we are traveling, metabolic conditions. Also, as natural as pregnancy loses a lot of hair from your scalp, and this leads to anxiety and sometimes withdrawal from the scene. Of course, it is mandatory that I look into the cause of the problem and then solve it. On the medicinal part of it, what do I have to give? Dietary nutritional supplement, because that's extremely important. Medicines which I will give you to apply on the scalp, they are equally important because we need the local production of the hair. But so many times I have to go one step advanced than that and introduce some kind of hair treatments. Now, hair treatments, if I spread it across, they are mesotherapy. So the common ones are PRP and GFC, and also the hair transplant. So today in this video, I'm going to open up all the facts about all these three treatments, which usually the clients are very confused about. So when we are looking at hair regrowth or getting back your lost hair, growing the baby hair on the scalp, we are talking about mesotherapy on the most non-invasive. Many people dread surgeries. They do not want to do anything aggressive, but yet want the hair to be getting more stronger, looking more hydrated, looking more bouncy and nourished, and also grow the hair back. Mesotherapy will do all of that. It's a non-surgical procedure. It is a procedure in which we actually make micro channels on the scalp with a derma roller or a derma pen. Post that, we introduce a lot of multivitamin concoction on the scalp, which will help to nourish. So the motto of mesotherapy is to nourish your hair roots, the hair follicles, and in turn, when they get good food with these kind of concoctions, they will grow well. They grow more in kind of length, their quality improves, and you have a good hair at the end. It cannot be attained in one single session. You need at least 6 to 8 sessions, about 2 weeks apart, and this is all about mesotherapy. In an advanced stage of hair fall or hair thinning, what we have to introduce is called as PRP, or a little advanced version of that is GFC, which is growth factor concentrates. This is again a non-surgical procedure in which the blood components, especially the platelets, are revolved in a centrifuge machine after we collect the blood from your body, quantitative of about 8 ml or sometimes 16 ml, and we harvest that in a centrifuge tube with a good quality of serum. Now this serum or growth is concentrated with growth factors, which is procured from your blood components as platelets. We remove that and inject that at the place where we need the hair growth. Now this is a type of regenerative medicine wherein naturally there is no chemical going in. It is a very safe procedure. It is a very sterile procedure, and your own growth factors are injected back into the hair follicles, which needs the growth to be happening. These are very promising treatments because we know how much of growth factors we are removing, and that concentrated golden fluid, we call it also as, is injected back into your hair follicles. They will regenerate many areas of the hair, like your, it will increase the vascularity. It also affects the hair root growth cycle. So all of these components work extremely well towards giving you a robust, good quality and a thick hair, and a hair which actually grows back. And this is what you want. So PRP also, or GFC also, needs multiple sessions, about 4 sessions to 6 sessions in an area where there is moderate baldness, and it works very well. And now we come to hair transplant, which is a surgical method done by plastic surgeons or hair transplant surgeons. Now this is usually opted in people having high grade of baldness, in which there are no hair follicles available on that area of baldness. So we procure the hair follicles from any other area. For men, usually from beard, back of the scalp. Sometimes we take it even for arms and the chest. If that body area has good hair follicles, and those are literally transplanted, they're plucked out and plucked in at the areas of the baldness. It takes about 1 or 2 sessions. It's a surgical procedure. You may need to follow up. You need to have some instructions around you so that we nurture that baby hair, which will come up after 3 to 4 months, and it lasts for about maybe 2 years to 5 years. This is the longevity of the transplant. So basically, it is mild to moderate hair fall. Mesotherapy, PRP are the best choices because they will give you a natural hair growth. They are much more doable, and multiple sessions will give you a great result to come up with supplements and other medicines which the dermatologist offer. While in a case where there is quite an enlarged area of baldness, hair transplant would be a better solution. So I hope this clarifies a lot of myth and a lot of doubts about the treatments which we offer for hair follicles under development or maybe hair thinning or hair fall. I would love to answer any of your queries, so please comment below if you have any other problem regarding hair and skin, and do subscribe to my channel for more such content.